Hi everyone, my name is Ryan Borges and my research topic and question was, what characteristics do athletes have that engage in doping as a performance enhancer in sports? Looking back at chapter 4, we learned about how we can incorporate sportsmanship and also character education, how we can teach or steps to teach sportsmanship. And we also learned a little bit about the bullying and hazing that unfortunately takes place in sports. This presentation, however, is going to look at the negative effects. Let's say if a coach didn't teach sportsmanship and incorporate character education, and one of those effects could be your athletes choosing to engage in doping. More specifically, this presentation is going to examine the characteristics and motivations differences between athletes that do engage in doping and that choose not to, if goal orientation has an effect on doping, and what can coaches do to eliminate and prohibit doping amongst their athletes? And the reason this topic is important is that it was found that about 3 to 6.5% of boys and 1 to 2% of girls reported to either currently or previously used anabolic steroids. So this slide here is going to show some negative side effects of steroid abuse, and some of it you might be familiar with. Sorry about that. So some effects would be an overgrown forehead, baldness, infertility, breast development, shrinking and premature aging, heart attacks, high blood pressure, and some psychological effects such as aggression and mood swings. Some research studies, and one in particular that examined sport motivation and doping in adolescent athletes, included 1,035 adolescent competitive athletes who all completed, oh, and I apologize, PowerPoint's acting a little funny. These athletes all completed a battery of questionnaires that assessed their goal orientation, so whether they were task or ego oriented, their sport motivation at various levels of self-determination, so if they were intrinsically motivated or externally motivated, and their moral attitudes towards sport competition and doping. Interesting enough, findings show that intrinsic motivation had a negative relation to attitudes towards doping and acceptance of cheating, while intrinsic motivation and a motivation had a positive attitude towards doping. So winning may not be as important for the occurrence of doping behaviors as the athlete's attitude towards doping and cheating in sports is. Another research study that examined the attitudes and its relation to doping included collegiate athletes, all part of the NCAA, and had the athletes were branched out between 8 sports that included baseball, basketball, football, golf, ice hockey, soccer, swimming, and track and field. The results suggest of this study that athletes' win and goal orientation and competitiveness did not play a statistically significant role in doping behavior, but win orientation did have an effect on doping attitude. It also found that using performance enhancers may be more of a rationale and outcome optimizing behavior as opposed to a defiant behavior and the athlete intending or their objective of just breaking the rules. Their intention was more so towards optimizing the outcome of their athletic performance. And in this research article, an interesting quote that I found was, despite that increased anti-doping efforts, the relative number of adverse analytical findings has not decreased considerably in the past 4 years. One other study that I found, and this focused a little bit more on the coaching side, was an intervention to optimize coach-created motivational climates. So the purpose of the study was to test the effects of a motivationally informed anti-doping interventions for coaches. The way this was conducted was coaches intervention group attended 2 workshops and received supplementary information to support them in adopting a motivationally supportive communication style. Coaches in the controlled condition attended a standard anti-doping workshop that provided up-to-date information on anti-doping issues, yet it excluded any motivational related content. Interestingly, findings showed, I should back up a little bit. The method also assessed athletes' willingness to dope and other secondary outcomes at a baseline level, a post-intervention level, that was 3 months. And also they did another assessment as a 2-month follow-up. The findings show that comparing athletes in the control group and athletes in the intervention group reported greater reduction in willingness to take prohibited substance and psychological need frustration at post-intervention and a greater increase in anti-doping knowledge at the follow-up. Coaches in the intervention group reported a post-intervention reported greater increase in efficiency to create an anti-doping culture and perceived effectiveness to deal with anti-doping related situations. To summarize, some key points is that intrinsic motivation is strongly related to acceptance of doping. So if an athlete is more motivated to earn a gold medal, or things that are just more intrinsically achievable, they may be more willing to dope or find ways to have an advantage over their competitors. Athletes' attitude of doping are a greater indicator of doping use than goal orientation. Also, athletes can be extremely competitive and have a negative attitude towards doping. And this could also relate to a coach having their athletes be motivated to achieve as much as they possibly can, but making sure that they still are intrinsically motivated and they're looking for self-improvement. Coaches incorporating motivational theory can help reduce athletes' attitudes towards doping. And my discussion questions would be, how might a cooperative coaching style reduce PED use by athletes, and how can their attitudes toward doping be changed by the coaching staff? If one of your athletes was caught doping, how would you respond to this situation in a way that could prevent other athletes to choose to dope also? And also, finally, what aspects of this presentation did you find particularly insightful, and why? And here is my references. Thank you so much for listening. And I hope you enjoy the discussion and this presentation.